A Ladysmith family is terrified they will lose their sick little girl because of a lack of emergency training in the area. Evelyn Linden is home from hospital now, but is on a ventilator and requires 24-hour care as her family tries to give her some normalcy in her short life. But as Sky Ryan reports, her parents are afraid she won't get the care she needs if an emergency strikes.
Twinkle, twinkle, little star, how I wonder what you are.
Almost as soon as Janice Bowley found out she was pregnant, she learned the baby she was carrying would be very sick.
I had a meeting with a couple of the doctors in Vancouver who at 25 weeks told me I should probably terminate. I told them, no way. This little girl's not giving up, so I'm not giving up on her either.
Against all odds, Evelyn Linden was born at 6 pounds 15 ounces and has survived with serious heart and lung problems, as well as her organs outside her body for 16 months since, 402 days of that in Children's Hospital in Vancouver.
I wanted her to be home and have some kind of normality in her life.
But now home in Ladysmith under 24-hour care and on a ventilator that requires constant suctioning.
Throughout the day. Yep, this is throughout the day. And through the night.
Her family fears how prepared local ambulance paramedics are for when this little girl's worst emergency hits.
When as soon as Ladysmith isn't properly trained for her, they actually have to call ALS from the NIMO, which is 25 minutes away.
So they want the local ambulance unit trained to respond to this infant's most severe attack, and believes that it hasn't happened because the money for training isn't there. What's your greatest fear?
That something's going to happen and they're not going to be ready.
But BC Ambulance dismisses that suggestion.
That is a stretch to the truth.
Superintendent Lance Stevenson says Ladysmith is ready to handle Evelyn's emergencies as much as they can right now.
To provide training up to an ITT level would take 5 years. She is in excellent hands for the level of care provided with BCAS. She will get, we have even gone as far as doing time trials to the scene so that we know how long it'll take to get there. It's been flagged in our dispatch computers.
But those assurances aren't enough for this family.
There you go, sweetheart.
Now keeping 24-hour vigil at their daughter's crib side, hoping that she keeps making it against the odds, now at home.